Hi there, I am Dr. Zakir, Senior ENT Consultant, and we are going to discuss about a condition called choanal atresia. This condition, it's common in a newborn baby. Now, before going into the topic, let me tell you in short about the structure of the nose. This part forms the nasal cavity, that is the nose. The posteriormost part of the nose here, this is called as the choana. I'll show you in a nasal endoscopy video so that you can understand better. So when you do an endoscopy and the endoscope proceeds further inside, the posteriormost part, this part is called as the choana. So when this choana is not, it's completely closed, it's called as atresia, that is choanal atresia. It can be on one side or it can be on both sides. It can be a bony type, it can be just covered with a membrane. It can be complete closure or it can be incomplete closure. These are the types which I will show you in one or two slides. So this is about choanal atresia. The classification and the type I have already mentioned. Usually a newborn baby, they are nasal breathers. They don't know that when there is a nose block that they have to open their mouth and breathe. They have not developed that reflex. Now, if in a case of choanal atresia, when that is choanal atresia on both nasal cavity and it is complete, it becomes a medical emergency. So usually there is a pediatrician there, and sometimes you can call a ENT also. So we will also go and help them. So the child will not be able to breathe normally through the nose. So child will be in distress. So what happens is immediately the pediatrician there, he put in a airway called Gudel's airway in the oral cavity and keeps the oral cavity open or patent so that the child is able to breathe through the mouth. It's kept open completely so that the child breathes through the mouth. And they will introduce a tube also for feeding. Now, once that is done, we can do a few tests to confirm. That is, we can put in a catheter, 8 French gauge catheter in the nasal cavity and see whether it comes into the mouth or not, oral cavity or not. If it doesn't come into the oral cavity, it means it is getting blocked behind the nose. So it gives us the pediatrician idea that it may be a case of choanal atresia. So this introduction of the catheter, it has to be in both nasal cavity. Likewise, what we can do is, we go there and we used to do an endoscopy. We have special pediatric endoscope of 2.1 diameter, mainly for the newborn babies, and we have a portable camera also, so that we can take it there to the NICU, and we'll introduce to the nasal cavity. That light has to be seen in the oral cavity. The whole endoscope can be proceeded into the oral cavity. If it doesn't come, that means it's a case of choanal atresia, and we'll go ahead and do a emergency high resolution CT scan. It will show us that there is a choanal atresia and what type of choanal atresia, whether it is one-sided or both sides, whether it is bony or membranous. Usually, these type of children, they have coexisting cardiac problems also. The cardiac problem, they can be like tetralogy of Fallot is a major problem. I am not going into detail about it. They can have cardiac problem, they can have renal problem, they may have audiological hearing problem and eye problem also. So they undergo a battery of tests like we have to do cardiac echo, renal ultrasound, hearing assessment, eye examination and so on. Now, coming to the treatment. The treatment, I have already mentioned how to manage an emergency condition. Once the emergency condition is taken care of and the child is fit otherwise to undergo a surgery by all parameters, what we have to do is, we have to open up the choana. So what we do, nowadays we have these powered instruments, and with the powered instrument, when it happens to be a bony type of choanal atresia, we used to drill and open up the choana completely, and whatever the flap we have elevated, we will put it over that part. And at the same time, to keep it patent, we used to place tubes on both nasal cavity, and these tubes will be placed at least for a few weeks. Otherwise, it will result in stenosis. So there are different school of thought. Some surgeons do that, some don't. That depends upon the surgeon's training or will. Now, experience. Now, coming to the taking care of the baby, soon after the baby comes back after the surgery, when the tube is kept in the nasal cavity, it has to be kept patent always. So, the staff nurse will be doing regular nasal suctioning. If all other parameters are normal and the breathing is normal and the child is fit for discharge, we first give a good training to the caretaker or the mother to how to use a nasal suction in the nasal cavity, so that the child doesn't get nasal block because of the secretions. So, once the training is over, which lasts for 1 or 2 days, and all the parameters are over, the child can be sent home when we are very confident that the child can be taken care at home. Otherwise, the child will, till the tube is removed, the child is comfortable, we will keep the child in the hospital. Otherwise, the child will be sent home and will be on regular follow-up, and during the time of removal, again the child will be admitted for 1 or 2 days. So, this is how we manage choanal atresia. Thank you so much.